we are primarily here because we want to discuss what is apparently a real problem in the state of Florida, and it involves the federal government as well. Children's medical services in Florida has long been recognized as one of the finest for very sick children in the entire country. Then the question is, why did the state of Florida take 13,000 children off of that specialized program for poor children's health, waited for 2 years before it informed their parents that they were re-eligible to apply, and then when it did, only informed 6,000 of the 13,000 families. Thus, Congresswoman Castor and I have written to the Department of HHS asking them to see that these children, in fact, are being cared for. These are children with birth defects like club foot, cleft palate, that need specialized care. These are children with heart defects. It could be diabetes. It could be blindness. And what brought this to light was a CNN report that documented this after interviewing several of the families with the children involved with those kind of disabilities that I've just mentioned. So what Kathy Castor and I want is we want a response as to why this happened. We're not making any accusations. We want to know, why did the state of Florida take these children off this specialized medical care program that has been so effective and popular, and waited for 2 years to contact less than half of their parents, than to tell them that they were eligible to re-enroll. Congresswoman?
Well, thank you, Senator Nelson, for standing up for children across the state of Florida, especially our kids with the most complex medical conditions. Imagine if you are a mother or a father of a child with a complex medical condition, and you, for years, have developed a relationship with your pediatrician and caregivers. You're getting the best care, the highest quality care in the most efficient manner. And then the state of Florida comes along and says, you're no longer eligible. We've screened you out, without any real rationale for doing so. Well, that is what has happened here in the state of Florida, and it's unconscionable. Last year, when pediatricians across the state stood up and said, wait a minute, we do not have the ability to see our patients that we once did, an administrative law judge in Tallahassee said, Rick Scott, Governor, Department of Health, what you have done in screening out all of these children is inappropriate, and it runs in contravention to law. They had the direction then to fix this and go back to those families to make sure they get the care that they need. They've dragged their feet. Last year I had to ask the Federal Department of Health and Human Services and the Center for Medicaid and Medicare Services out of Washington to clarify for the state of Florida that they had the right to go and inform all of these parents. And nevertheless, the state, the governor, the Department of Health has dragged their feet. And I know they dispute this, but all you have to do is go to some of these families and ask them, and talk with the pediatricians who are saying they no longer are able to see these kids. And these families are heroic. You know, think about what it takes to take care every day of a child with a complex medical condition. It's not easy. You don't have time to fight the bureaucracy in Tallahassee. But many of these families have stepped forward to do so, and thank God for their doctors and the pediatricians and the caregivers across the state who have said this is not right. And we agree. So we're asking federal Health and Human Services and the Center for Medicare and Medicaid Services again to provide oversight of what's happening here in Florida so that children with the most complex medical needs across the state can continue to see the doctor and caregivers that have served them well. And Senator Nelson is right. You know, this special initiative in Florida developed in the 70s and 80s that takes care of children with the most complex medical needs is a model, was a model for the nation. Caregivers and other doctors and states looked to Florida for this initiative because it was so effective and it was so efficient. And what a shame it is that Governor Scott and the Department of Health have obliterated it. It's simply inexplicable, and we want to know why.
Your questions?
What was the name of this program? This program has an acronym, doesn't it?
CMS.
CMS?
CMS, that's the state program. Children's Medical Services. It's been around for decades and decades, and it's an award-winning program. And the way it's administered is they usually have a person that would be like a caseworker assigned to a group of children to make sure that they're getting to the right specialist. And these are children that are usually from poor families, and they are children that are usually paid for through Medicaid. But CMS in Florida has been fantastically popular and successful, and the overall number of children that have been on it are about 60,000 in the state. So they've taken 13,000 of those children off the rolls.
And this is not the state's money, this is federal's money, right?
Medicaid is a joint program. The state gets from the federal government something just in excess of 60%, and the balance, like 38%, is state funds. That is a formula for each state different according to the number of poor children or poor people in the overall Medicaid program.
Senator, the Department of Health, Florida Department of Health, exercised a rather unusual step, sending out an email to many of us before this event, charging that the CNN report is based on outdated information, saying that it was 2-year-old information, that they don't do that, and they have not denied service to any children. What do you respond to that?
Yes, I read that response, and nowhere do they answer the question, why did you wait for 2 years once you realized or were told by a judge that your screening tool was unlawful? Why did you wait 2 years for these very, very sick children to contact their parents to tell them that they could enroll? And secondly, why did you only reach out to 6,000 of the 13,000 children that you took off of the specialized medical care program?
What do you think the answer is to that?
I don't know. And that's why Kathy and I have asked the question. If the state of Florida is not giving that answer, which they obviously is not, including today, then the federal Department of HHS, in its oversight capacity, should hold the state of Florida accountable to answer those questions.
On that issue, Senator, what action can HHS take?
We will see if they take any action at all. But you've got 2 members of Congress here that are going to keep demanding answers. And indeed, in my case, I sit on the committee that has the oversight over Medicaid.
As do I.
The CNN article references that the reason these kids could have been kicked off was because to favor the insurance company
I'm not commenting on that. I'm asking for answers why poor children, very sick with huge special medical needs, were kicked off that program and not notified for 2 years that they could be back on the program.
No, you're not commenting on that, but does the allegation that, politics was involved, does that impact your confidence that the federal government will answer your call to help?
Well, you've asked 2 questions, and maybe 3 or 4. Your first question is, you're going to have to ask CNN, because they're the ones that drew the conclusion that you're talking about. The second question, you're asking, do I have the confidence in the Department of HHS? I can tell you that I voted against Secretary Price. I did not feel like that he was qualified, nor would he look out for the interest of poor people who are sick. And I think we're finding that, especially when he proposed the repeal and replace plan that took $800 billion out of Medicaid over a decade. That would have eviscerated Medicaid as we know it for poor people, for disabled, for children, and for senior citizens in nursing homes.
Yeah, and I'll add, we've spent the first 7 months of the year fighting against the GOP plan to rip health coverage away from families across the country, particularly our families that rely on Medicaid for their health care needs. And in Florida, that means a lot of children. But I certainly hope that HHS will take their responsibility seriously here. They have in the past, because we're talking again about the children with the most complex medical conditions and their families, really just trying to get through the day. And think about what that has meant to have that consistent pediatrician and specialist and doctor with them, sometimes for years at a time, and to think that that bond has now been broken inexplicably makes no sense. So we really do need answers.
Any other questions on any other
What's
topic?
wrong with Medicaid that it doesn't work for these families?
Say again?
What's wrong with Medicaid that it's not good enough for these families?
Well, it may. That's not what we're questioning. What we're questioning is, here was a very successful program for children that have very, very special medical needs. And it was serving these children and their poor families very well. And suddenly they yank them off. And then a judge says that was unlawful, but they take 2 years before they go back and notify some of the parents that, in fact, they're eligible to re-enroll. That's what we're questioning.
You want to take other questions now?
Of course.
Could you comment on what's going on with FEMA and your letter to them to address the deadline that was missed by the State Department of Emergency Management?
Okay. In this case, this is primarily an issue on the east coast of Florida. Last October, Hurricane Matthew came along. FEMA came in, did a lot of help to people as well as to local governments. But one of the big aftermaths that FEMA pays for is debris removal. And you can imagine all the debris that was stacked up. Well, FEMA was dragging its feet. So the counties went out and borrowed money, the cities borrowed money to remove it and then to get reimbursed by FEMA. In fact, the state of Florida missed the deadline because the state has to apply for that debris removal reimbursement money. They missed the deadline. There's a story out this morning that 2 employees in the Florida department that handles that were fired. That still doesn't help all of the counties and the cities that are in the hole for in this case, millions of dollars. And so what I've done is ask FEMA to overlook the state of Florida's mistake and to please let these counties and cities reapply. So that's the story that you're referring to.
Senator, have you heard anything from FEMA on the extension request?
No, because that request has been made just, I can't remember the day, but I have not.
What are you hearing from the...
I think that the request that in the appeal that FEMA pay for this reimbursement, I think it's bolstered by the fact that now the state of Florida has admitted their mistake by firing these employees.
What are you hearing from the counties that were impacted by this?
Well, for example, I met in Volusia County with 25 local government, city and county managers. And I'm telling you, they're desperate. They've got a big hole in their budget because FEMA is not reimbursing them the cost that they front-loaded to clean up after Hurricane Matthew. And that's not right, and that's not the way the federal government ought to be functioning.
So, just overall for that, was the Department of Emergency Management's response adequate?
Well, obviously no, by their own admission.
In a lot of ways, the Tampa Bay area and Houston are very similar, low-lying, coastal, in the path of hurricanes potentially. What is Tampa Bay doing, or other places in Florida, if you'd like to answer that, differently than Houston that would say the next big storm, we don't see what's happening in Houston here?
If a Category 5 hurricane came right into Tampa Bay, you are talking about enormous destruction. You're talking about enormous flooding. And you are talking about damages that would exceed what we saw in Hurricane Sandy, as well as what we're going to see in the East Texas situation. Remember, when this hurricane hit just northeast of Corpus Christi, it was a Category 4, but that was a long way from Houston. Then it downgraded, and then it meandered around just as a tropical storm. And that brought the enormous floods that we are now seeing in East Texas and western Louisiana. If you magnified that with the force of the wind from what you're seeing now with a tropical storm to a Category 5, and it's coming right into Tampa Bay, wind damage along with the wall of water that Category 5 winds would bring in excess of 140 miles an hour, it would be catastrophic. And I can tell you that no insurance company is prepared, and that's why years ago, when I had the toughest job in government that I've ever had, the elected insurance commissioner in the aftermath of Hurricane Andrew, we had to set up a reinsurance fund, and today it's quite successful. The Florida Hurricane Catastrophic Fund, which has billions of dollars of reserve funds to protect insurance companies under this circumstance. The federal flood insurance program is a different deal, and this is what Kathy and I have got to try to get our colleagues to face the music by September the 30th, because the federal flood insurance program runs out September the 30th, and obviously it's got to be reauthorized, especially what we're seeing in Houston.
Can I comment?
Yes, please.
Sean, I really appreciate you asking that question because just watching the pictures out of Houston, I think all of us understand that could very well be us in the Tampa Bay area. And we all love living here. It's one of the best places to live in the world, but it's risky. And with the cost of the changing climate accelerating, we simply have to take a new look at everything we're doing, the way we build, flood insurance. Thank goodness, when we look at the state of Florida, we have a lot more residents with that flood insurance. So many of those folks in the Houston area do not have flood insurance. And remember, your homeowner's insurance policy does not cover the cost of flood. As flood insurance is reauthorized, we've got to make sure it's there for any potential storm that comes to Florida. But we've got to do a better job on those floodplain maps so that we really understand where it's not appropriate to build, where it's appropriate to invest in mitigation to raise the elevations of homes and businesses. But I think right now, with the changing climate and the risks that we're facing, I think it's time for a real conversation here in the Tampa Bay community and statewide to make sure that we're minimizing the risk to lives and property.
Senator, what type of politics are going to come to the Congress's floor in regards to funding Houston?
Part of the debate will be vigorous. At the end of the day, the funds will be made available from the Congress. But this is not going to be funds just now. This is going to be funds over many years. So let me tell you what's going to be said in the debate. The members of Congress from New York and New England, they're going to say, why did a huge portion of the Texas delegation vote no on the funds for FEMA for Hurricane Sandy in the northeast of the United States? At the end of the day, we'll have the votes. But that's a legitimate question. Why did not a lot of the Texas delegation support other Americans in need, and now they want help in need? I am very confident that the Congress will provide the funds to help the people of Houston and East Texas.
And Senator, we've asked you this 3 weeks in a row now. The rhetoric and the words from the president on North Korea are still there, and there are mixed messages coming from the government, from the Department of Defense as well. What are your feelings as this continues?
As we speak, there is a joint exercise going on between South Korea and U.S. military forces. Again, there is no easy option with a childlike dictator who has 60 nuclear weapons, as reported in the press, and who is racing to miniaturize a nuke and integrate it into an ICBM that will threaten the U.S. The choices are do nothing, number 2, go to war, or number 3, try to negotiate. In negotiation, you desperately need China to cooperate, and thus far they have not been a willing partner to help. And therefore, it is still a precarious position for the U.S. and the protection of our people, and will continue to be so, not only for us, but for our allies in the region, which is obviously South Korea and Japan.
Congresswoman, are you worried about the mixed messages coming from the president and then something different coming from the Department of Defense?
Yeah, you know, when I listen to President Trump, whether he's talking about North Korea or the Middle East or Afghanistan, what is missing is a greater emphasis on diplomacy and making sure that we're building those relationships, sustaining those relationships, because America cannot do all of this on our own. I know people think we're the world's policemen, but we are often stronger when we have our allies working with us, bearing the financial burden, bearing the diplomatic burden. That's what must happen when we're talking about North Korea as well.
Are we good? Thank you. All right.
Great.
Thank you very much.
Thank you.
Thank you so
Okay.
much.
Rest up.
This is great.